Hi, March is Colon Cancer Awareness Month, and what I wanted to do is share a few facts that are out there about colon cancer that you may or may not know, and I'm pretty sure most people can think of somebody in their family or is touched by someone who's been affected by not only cancer, but colon cancer. Now, colorectal cancer, now it's the third most common form of cancer, and it's the third leading cause of cancer death in both men and women. 90% of colorectal cancers are diagnosed in people over the age of 50. And even the American Cancer Society, I'll get into this a little bit more, but they usually recommend that, I'm sure you've been exposed to this, but they usually recommend that there's a yearly occult blood test, which is usually done in the office. It's a small sample that they want you to collect at home. Is usually, they call that an acceptable screening for people 50 or above. And practicing functional medicine, we're trying to instill the tenets in the way that we view people and say, what does colon cancer, what does it mean, how does it manifest, and what are there other ways to look at it? Now, there's one way to look at it and say, okay, a cancerous situation or cancer disease develops because of dysfunction in the body. Cellular dysfunction, nutritional dysfunction, stress, multiple factors. Blood sugar is a big one too. So there's the aspect of understanding the disease itself and steps we can do about it after the diagnosis. And this is where pretty consistent screening comes in, and then following through on treatment based off medical providers, which is always recommended. I'll get into a few of these later too about what we recommend. So then there's the treatment aspect. So when you look at things from a functional medicine perspective, our hope is that we not only address maybe someone with colon disease or colon cancer, but maybe get more into why did the body harbor such a situation in the first place? And this can be colorectal cancers, but also many other cancers. Now, if you have more of the family history of colorectal cancer and more of the risk factors associated with that, things like chronic constipation, maybe poor diet with less fiber or vegetable intake, that's a significant cause. So things like that can predispose us. I mean, we really need to be aware of those things and take proactive action. So, first of all, testing. Because they said that a yearly screening is acceptable, they talk about an occult blood test. What we do in our office, what we recommend, and what you'll be finding out more is what we're recommending to you for this month is an at-home, easy to do, simple screen that you collect a sample with a small applicator or brush from a stool sample. I know this is kind of not everybody's favorite topic, but because of that, it's simple, and we send it into the lab. It's very easy, and it gives us an indication of, is there any bleeding or things that should not be there that may cause us to be of concern. So, but very acceptable to do, very easy to do, highly recommend it, especially for those who are over 50. If people don't want to go into their primary care, they don't want to investigate, we do see people that they just don't want to know, or they don't want to take the steps to go in and talk about these things. This is something you can do easily at home to kind of do a brief screening. Now, I must say that this does not diagnose any cancer, and it does not, and a negative lab doesn't necessarily say there's absence either, but it does say if you're at that risk, where you're at that age, and you may have maybe other bowel issues, chronic constipation, you've had bleeding before from the gut that you notice, and there's family risk associated, or you just may want to know, we do recommend you actually at least think about starting the process of looking at, do we have any signs that there could be something wrong that we need to investigate deeper. So I know this month we are offering that lab at a cost for you, but also I think it's a decreased cost to you, but I also think it's valuable in the sense that it's allowing you to be proactive and say, I haven't had this done. can I take some easy steps, or maybe a family member can take some easy steps to at least start the process of screening of any intestinal bowel inflammation that we need to be aware of. So highly recommend that. From a functional medicine perspective, if that's positive, we want to investigate why. Is there really is there a cancerous process, or is there just some things that we need to think about maybe from a dietary perspective? We see people who have maybe poor diets that cause excess inflammation. People who, again, are constipated and need some work in that area. So we need to figure out more of these underlying causes and get to the underlying issue to make lifestyle changes. Now, again, from a functional medicine's perspective, a few questions are asked. Well, from a nutritional perspective, or even supplement perspective, what are things I can do for colon cancer risk, colon cancer support, if you will? Now, there's nothing that's going to treat anything, but I want to give you two options that talk about things that may lower inflammation or even support those who have a higher risk. So one is curcumin. Curcumin is in the ginger family, and it's been shown to have some anti-inflammatory effects. I mean, the research is still it's back and forth, but what they do know is that it's not absorbed very well, but it stays in the gut. And that's huge for this situation, because if you have a lot of inflammation of in the gut area, or even other areas like joints and things like that, curcumin can be very valuable to you to actually lower inflammation in that area specifically. So even though it's not absorbed the best, that's probably to your advantage to stay here in the GI tract to really kind of support excess inflammation and help calm that fire down, which is very helpful and supportive of any kind of disease process. The other one I think is very important is fiber intake. It's pretty well known that most Americans do not get close to the amount of fiber that they need in their diets, mainly due to processing and fast food intake and things that plus we're not eating 12 servings of vegetables a day. It's ideal, but be honest, it's kind of difficult. So when that's the case, added fiber can be a very supportive thing to kind of help make sure things are clean in the gut. The GI tract is a toxic warehouse that is used to carry things out, garbage, metabolism byproducts. So you've all heard that it's very important for bowels to move all the time. I can't stress enough, especially in the functional medicine world, if we're not having consistent bowel movements, that's a clear sign of disease, hormone problems, fatigue, sluggishness, weight gain, but also cancer risk. So fiber is an easy thing to add for anybody, not only for those who are worried about health and colon health, but also just everyday supportive lifestyle. It helps lower cholesterol, So we use a fiber. It's in a powder and capsule base, but I tell people powder is great because you can add it to a shake or a smoothie. You can make muffins with it, and it gets that extra boost in your gut to help clean the gut out, clean that toxic junk out. So when people have a diagnosis of colon cancer, it's important to know why. Why did the body get to where it's at to allow it to harbor a disease process? And what can you do to fix it and to solve it? Not really treat it, but support the body in getting over it. Functional medicine shines at that. The second part is prevention. I think we're all wanting to be proactive and preventative. One, is there simple screening you can do, especially if you have a risk factor in the family, but also over the age 50, men and women. Easy to do, simple, discreet, and we can talk about how we go over results with you. The second part is nutrients that can be added to our diet that may be supportive. If we have a high levels of inflammation in our life, in our diet, in our gut, we can use things like curcumin. We use a specific curcumin in our office that we're actually doing a special this month to promote colorectal cancer prevention. The other one is excess fiber. I like to add it to my shake. It's easy. Taste is debatable, but when it comes to prevention, I think you do the things that are difficult to do to get the outcomes that you want. Prevent disease, live longer, and be well. So thanks for your time. Please contact our office for any questions anytime. But also take advantage of these specials we're doing this month. Maybe you or even a family member you're concerned about, elderly family member. Simple things you can do to really make dramatic impacts on their health. Thanks, and have a good day.